The HSE have confirmed that the contract for the GP clinic in Bangor has been extended until the 31st of March. The initial offer for the Bangor Erris Glenmoy GP was declined by the candidate, and Midwest News understands that the second choice candidate will be formally offered the position on Tuesday. This follows numerous efforts by the HSE to recruit a GP for both Bangor Erris and Glenmoy independently, which proved unsuccessful due to a lack of interest in either post. At a meeting organised by the Bangor Erris Community Group on Thursday last, the local community stressed the need to retain both practices. Erris-based TD, Sinn Féin TD Rose Conway-Walsh, says that the extension of the clinic in Bangor needs to be made permanent.
There was a packed meeting in Bangor Erris Hall on Thursday evening where the community gathered together to express their concerns, and I attended that meeting with other public representatives as well, Jerry Coyle and Sean Carey and Deputy Dara Callery. But yesterday, that was on Friday, we had some concern yesterday afternoon that the contract for the clinic in Bangor and for the staff in the clinic in Bangor wasn't going to be extended, because the HSE had told us that there was going to be an extension of the current arrangements until the 31st of March, which would give a window of opportunity for the second in line on the recruitment process to be offered the position of GP. But yesterday afternoon we had some concern that the clinic was actually not going to reopen on Monday morning. But now I've had confirmation from the HSE that that clinic in Bangor will remain open with the two staff there, the nurse and the secretary, until the 31st of March. And that obviously in the interim we will be doing everything possible to ensure that that is a permanent arrangement.
I suppose, what barriers are put in place that would stop that from becoming a permanent arrangement?
Well, the problem is that we've had two GPs here, which has been good in the sense, but when the recruitment process started for the individual positions of Bangor and of Glenmoy, there was no takers for that post. Now, when the two posts were amalgamated, there were applicants for that position, but there's about 1,100 GMS patients then on it. But the problem is that we don't want the HSE to take away the two GMS allowances, which would allow for the Glenmoy Clinic to remain open and the Bangor Clinic to remain open, fully staffed, and indeed the clinic in Gisala to be operational. So we need them to leave that GMS allowance in place as it was previously in order for that to be done, because we have to remember that a huge geographical area is covered by that primary care centre, by that GP. It's stretching from Dahoma Head to Ballacorick and then down to Carrataig, and it's not possible to deliver a healthcare service if either of those clinics were to be closed. So that's what we have to make sure, and that's why I'm in daily contact with the HSE around that, and working with the community as well to make sure that people in those areas have the healthcare service that they absolutely need and that they deserve.
And is it possible to keep that clinic open on a permanent basis even if the second GP doesn't take up the position?
Well, it's not. See, there'll be one GP for both areas. But for the GMS allowance, I think the HSE need to leave the two GMS allowances there to keep that staffed, because otherwise I can see that there would be challenges around that. So the HSE have to step in and take responsibility there. You know that our goal, obviously, for that area is that there would be a proper primary care centre there, that there would be a fully staffed primary care centre, similar that there is in Castlebarn and Westport and in many other areas. That's our goal, and that we would have like a helicopter pad there as well that can take people on emergencies from the area to the acute hospitals. And that is what I, as TD for this area as well, will continue to work on, to work as hard as possible on to make sure that that happens for people, because the people in Erris and the people in this area deserve the same health care and the same access to health care as they do in other areas.
Deputy Rose Conway-Walsh.